6 and 2, perfect. Agreed? Agreed. Okay.
Very welcome, Minister, to the House, and I suppose I just wanted to talk today about mental health and the correlation between physical and mental health difficulties, and how I believe that if the mental health issue was addressed here in this country, it could reduce your hospital beds. I really believe that. It is imperative that mental health is recognised and afforded appropriate priority within the wider health agenda to reflect its significance to contributing to the burden of disease in Ireland and its impact on other areas of life. Healthy Ireland survey reports that almost 10% of the Irish population over 15 has a probable mental health problem at any one time. This equates to approximately 325,000 people based on Census 2011 population data. Almost 20% of young people aged 19 to 24 and 15% of children aged 11 to 13 have had mental health disorder. According to the Suicide in Ireland survey, suicide is the leading cause of death in young males exceeding road traffic accidents and cancer. There is a strong correlation between physical and mental health difficulties. A recently published report by the Substance Abuse and Mental Health Services Administration in the US found that adults aged 18 or older with any mental disorder or major depressive episode in the past year were more likely than adults without these conditions to have high blood pressure, asthma, diabetes, heart disease and stroke. In terms of health service utilisation, adults with any mental disorder used both emergency departments and hospitals more than those without a mental disorder, leading to higher healthcare costs. The Healthy Ireland framework states that it's important to acknowledge the interplay between mental health problems and chronic disease. Depression is a very important public health problem and is often comorbid with chronic conditions. Mental health problems such as depression, when existing with any chronic condition, incrementally worsen health compared with having depression alone or chronic conditions alone. This reinforces the need to improve mental health well-being as a public health priority, to reduce disease burden and disability and to improve the overall health of populations, tackling risk factors and promoting protective factors for lifelong health and well-being in the early years, and building children's and adults' resilience to adversity is a central requirement of any population health framework. Healthy Ireland continues to report that mental health problems have huge personal impacts on those who experience them and result in significant costs relating to loss of productivity, premature death, disability and additional costs to the social, educational and justice systems. It is estimated that the economic cost of mental health problems in Ireland is 11 billion per year, Minister. Despite the high costs of mental health difficulties to Irish society, including the wider health sector, resources for mental health services continue to be disproportionately low compared to resources for physical health services. In 2017, there will be a 3% increase in revenue funding for mental health. However, this is much less than the 7.4% increase in revenue funding for the overall health budget. In 2017, mental health funding represents just 6% of the overall health budget, which is significantly lower than any other leading countries and lower than recommended in Irish mental health policy. AVFC recommended that the proportion of the total health budget allocated to mental health should be progressively realised to 8.24%. In both Britain and Canada, the proportion of funding is approximately 13% and in New Zealand 11%. This funding allocation will do little to address the historical underfunding and decades of neglect of Ireland's mental health system, let alone put in place the foundations for a modern mental health system, as required by national and international standards. In addition, the impact of failing to adequately invest in the development of mental health services will continue to have an adverse effect on other areas of society, including the wider health environment. Could the Minister please make a commitment that the proportion of the health budget allocated to mental health be increased to 8.24% in line with the AVFC recommendations? I would also like to highlight some issues around the lack of services and the denial of help for people with dual diagnosis. Dual diagnosis is a term used for people who are experiencing a mental health problem and a substance misuse issue. The presentation of dual diagnosis is now considered to be the norm rather than the exception. Dual diagnosis presents many challenges for health services. It's difficult to treat and has poorer outcomes such as increased risk of self-harm and suicide. In the UK, 74% of users of drug services and 85% of users of alcohol services experienced mental health problems. Dual Diagnosis Ireland, a registered charity, states that 76% of services fail to offer a specific service for people with dual diagnosis. People must be dry to access most addiction rehab services, but they can't get dry because of mental health issues. For example, social anxiety issues, and then drink to reduce this anxiety. Another problem is the addiction treatment services usually don't assess for other mental health problems. The main problem experienced by people who have dual diagnosis is that when they present themselves to a rehabilitation centre, they're not treated for their underlying mental health issue, and when they present themselves to the mental health services, the substance misuse is not addressed. I recently heard a woman in Cork talk about her sister who had dual diagnosis but would not be accepted into a drug treatment centre as she was not clean and was subsequently raped while living on the streets. The fact that something like this can happen in our society is an indictment of our health services. There is a general agreement that integration between mental health and addiction services is sorely needed and long overdue. Finally, I would like to commend the Minister on his support of the Public Health Alcohol Bill and feel that the passage of this legislation could not only address our unhealthy relationship with alcohol, but will also alleviate the 1,500 hospital beds taken up every day because of alcohol misuse. And I have no doubt that this legislation will save many lives, and I hope that your party will support you in that. Thank you very much.
Senator Keller.